This is the Coronavirus Daily Briefing for Wednesday, March 25th, 2020. I'm Brian McCullough. Prince Charles has tested positive. India has initiated the largest lockdown in human history, nearly one-fifth of the world's population. Why is coronavirus so hard to defeat from a medical standpoint? Worrying news that the virus might stay on surfaces longer than we thought, but hopeful signs that the virus might not be mutating quickly, and why that is good news for a potential vaccine. The number of confirmed coronavirus cases in the world passed 400,000. The number of coronavirus cases in the state of New York has passed 25,000. The number of cases in Spain has passed 47,000. And the death toll in Spain has surpassed 3,400, making it the hardest hit country behind Italy, which itself is approaching 7,000 deaths. France has become the fifth country to pass the 1,000 fatalities number. Prince Charles, the 71-year-old heir to the British throne, has tested positive for COVID-19, though he remains in good health, according to a statement. In Britain, when the National Health Service there called for volunteers to support medical workers on the front line, 170,000 people volunteered and signed up overnight. India has initiated the largest lockdown in human history. 1.3 billion people, nearly a fifth of humanity, has been ordered to stay inside unless absolutely necessary. Quoting the New York Times, India has reported relatively few coronavirus cases, fewer than 600 so far, but with the population density so high and the public health system so weak, Prime Minister Narendra Modi has imposed stringent measures to try to keep the country from sliding into the disaster that the United States, Italy, and other countries face. Quote, "There will be a total ban of coming out of your homes," the Prime Minister announced on television Tuesday night, giving Indians less than 4 hours' notice before the order took effect at 12:01 a.m. Quote, "Every state, every district, every lane, every village will be under lockdown," Mr. Modi said. "If you can't handle these 21 days, this country and your family will go back 21 years. The only option is social distancing, to remain away from each other. There is no way out to escape from coronavirus besides this," end quote. India has also banned the export of hydroxychloroquine, the malaria drug so in demand after President Trump and others have touted it as a possible coronavirus treatment. 3 U.S. Navy sailors have tested positive for the virus on a ship still at sea, stoking fears that the disease could run rampant aboard the ship before it comes to port, quoting the Washington Post. The 3 sailors were flown from the aircraft carrier USS Theodore Roosevelt, which is currently in the Philippine Sea, and taken to a U.S. medical facility somewhere in the Pacific. Of the vessel's 5,000-person crew, all those who came into contact with the 3 infected sailors have been quarantined, Stars and Stripes reported, end quote. As states ask for help from the federal government here in the U.S., especially with ventilator machines, the U.S. government's emergency ventilator stockpile has been revealed to be dangerously low. There are reportedly only 16,600 ventilators in the Strategic National Stockpile. It is estimated that the United States, in a worst-case scenario, could have as many as 742,000 patients in need of ventilators. Factories in Malaysia apparently supply as many as 3 out of every 4 medical gloves used on the world market. But due to COVID outbreak restrictions, they are only operating at half capacity. California will stop accepting new inmates in state prisons for the next 30 days. Officials in California also reported yesterday that a child had died of the virus in that state, but last night walked back that report, instead saying that the cause of death might have been something else. Amazon workers have tested positive for COVID-19 at 6 U.S. warehouses. And quoting the Washington Post, "Protecting people and protecting the economy are not mutually exclusive," Ohio Governor Mike DeWine said during his daily briefing on Ohio's response to the novel coronavirus. Quote, "The fact is, we save our economy by first saving lives, and we have to do it in that order. When people are dying, when people don't feel safe, this economy is not going to come back," the governor said. "That's why we have to flatten that curve and do everything we can to separate ourselves from others so that when that wave comes, and we know it's coming, we're prepared for it," end quote. As you know, there are currently no specific treatments for COVID-19. with scientists racing to trial drugs and develop vaccines. So what actually makes COVID-19 so difficult to defeat, to treat? The Washington Post has a great explainer on this. Check out the full article, which is linked in the show notes, which delves into precisely why this virus is proving so difficult to handle, quoting from the piece. Respiratory viruses tend to infect and replicate in two places, in the nose and throat, where they are highly contagious, or lower in the lungs, where they spread less easily but are much more deadly. This new coronavirus adeptly cuts the difference. It dwells in the upper respiratory tract where it's easily sneezed or coughed onto its next victim. But in some patients, it can lodge itself deep within the lungs where the disease can kill. That combination gives it the contagiousness of some colds, along with the lethality of its close molecular cousin SARS, which caused a 2002-2003 outbreak in Asia. Another insidious characteristic of this virus, by giving up that bit of lethality, its symptoms emerge less readily than SARS, which means people often pass it to others before they even know they have it. It is, in other words, just sneaky enough to wreak havoc worldwide, end quote. We also know that this virus can remain viable, that is, stay potentially infectious outside a host body for up to 24 hours on surfaces like cardboard, and up to 3 days on surfaces like plastic or stainless steel. So it's a potential cocktail of being highly contagious, highly transmissible, and, as the statistics show, more dangerous than other viral illnesses such as seasonal flu. The problem is, developing drugs to defeat viruses is always difficult. Quoting again from the Post, most antimicrobials work by interfering with the functions of the germs they target. For example, penicillin blocks a molecule caused by bacteria to build their cell walls. The drug works against thousands of kinds of bacteria, but because human cells don't use that protein, we can ingest it without being harmed. But viruses function through us. With no cellular machinery of their own, they become intertwined with ours. Their proteins are our proteins. Their weaknesses are our weaknesses. Most drugs that hurt them would hurt us too. For this reason, antiviral drugs must be extremely targeted and specific, said Stanford virologist Carla Kierkegaard. They tend to target proteins produced by the virus using our cellular machinery as part of its replication process. These proteins are unique to their viruses. This means the drugs that fight one disease generally don't work across multiple ones, end quote. There is some good news, though. The paper quoted in that Washington Post piece says that COVID-19 has proteins with a similar enough shape to the original SARS virus that some of the research done to combat that outbreak and some research undertaken since could be useful now in the race to develop a vaccine for COVID-19. Let me pick up on something we just talked about in that last segment. A new report from the CDC says coronavirus particles were detectable in cabins aboard the Diamond Princess cruise ship long after passengers had departed. The Diamond Princess and its 3,711 passengers and crew were placed in quarantine at a Japanese port on February 4th after a passenger on a previous voyage tested positive for COVID-19 after returning to Hong Kong. Quoting from CNBC, the ship quickly became what was, at the time, the largest cluster of confirmed COVID-19 cases outside of China, with more than 800 passengers and crew eventually becoming infected. 9 people died after disembarking the ship. The Japanese government and other nations eventually evacuated their citizens, end quote. Well, the problem is nearly half of the passengers and crew who tested positive for COVID-19 were asymptomatic, and the CDC notes that, quote, the high proportion of asymptomatic infections could potentially explain the high attack rate among cruise ship passengers and crew, end quote. But, more disturbingly, the CDC later found traces of COVID-19 genetic material in cabins several days after they had been vacated. Previous studies have found that coronavirus remains viable for up to 24 hours on cardboard and up to 72 hours on plastic and stainless steel. However, quoting the CDC, COVID-19 was identified on a variety of surfaces in cabins of both symptomatic and asymptomatic infected passengers up to 17 days after cabins were vacated on the Diamond Princess, but before disinfection procedures had been conducted. Although these data cannot be used to determine whether transmission occurred from contaminated surfaces, further study of fomite transmission of COVID-19 aboard cruise ships is warranted, end quote. Cases linked with cruise ship travel have been reported in 15 U.S. states, according to the CDC. The country of Iceland is testing a far higher proportion of its population than anywhere else in the world, at a per capita rate of more than 10,000 people per million, compared to around 2,500 people per million in Italy. Quoting from BuzzFeed News, mass testing on the scale adopted in Iceland is unlikely to be feasible across larger countries. However, it has proved crucial in some of the other areas hardest hit by the novel coronavirus so far. The testing has provided evidence revealing that a significant portion of those who catch the disease do so with no or mild symptoms, and confirmed multiple pieces of research that have shown that asymptomatic individuals contribute to the transmission of the disease in great numbers. In the small northern Italian town of Vo, one of the communities where the outbreak first emerged, the entire population of 3,300 people was tested. 3% of residents tested positive, and of those, the majority had no symptoms, researchers said. The population was tested again after a 2-week lockdown and isolation, and researchers found that transmission was reduced by 90% during the lockdown, and all those still positive were without symptoms and could remain quarantined. Luca Zaia, the governor of the Veneto region, told Italian media this week, quote, "We tested everyone, even if the experts told us this was a mistake. 3,000 tests. We found 66 positives who were isolated for 14 days, and after that, 6 of them were still positive. And that is how we ended it," end quote. Zaia hopes to extend mass testing to the entire Veneto region, which estimates it can process between 20 and 25,000 testing kits per day to bring the wider outbreak under control. Quoting again from BuzzFeed, the World Health Organization has urged countries to test more suspected cases. Quote, "You cannot fight the fire blindfolded, and we cannot stop this pandemic if we don't know who is infected," Director General of the World Health Organization said this week. "We have a simple message for all countries. Test, test, test. Test every suspected case," end quote. And the governments fighting back against the coronavirus say that extensive testing has led to substantial results and saved lives, end quote. Around the world, companies are stepping up to fill the need for hospital equipment, from personal protective equipment like masks to much-needed ventilators. In North Carolina, for example, one of the United States' largest yarn producers, Parkdale Mills, has started a coalition of 8 companies, including Hanes Brands and Fruit of the Loom, to manufacture face masks for healthcare workers. Parkdale says it has been working closely with the White House to cut through red tape and get the masks certified by the Department of Health and Human Services. Production began on Monday, and deliveries should start this week. Once the operation gets up to full capacity in about a month, Parkdale expects to be producing as many as 10 million face masks each week. In another coalition of major U.S. companies, Ford is partnering with General Electric and 3M to produce respirators, ventilators, and face shields. Quote, Project Apollo will use car parts and factory tools to get necessary equipment to healthcare workers and first responders as soon as this week. By using fans from F-150 pickup seats, hoods from assembly plant paint shops, 3D printed parts, and other makeshift supplies, Ford aims to boost 3M's current respirator production tenfold, manufacturing as many as 1,000 respirators a month. They also aim to make 100,000 face shields a week and are partnering with GE Healthcare to expand production of GE's existing ventilator design. Executive Chairman Bill Ford told the Today Show, quote, "We were the arsenal of democracy during 2 world wars. We built iron lungs for polio patients. Whenever we're called on, we're there," end quote. Meanwhile, in Switzerland, Hamilton Medical, one of the world's largest producers of ventilators, has ramped up production by 40%, hiring more staff and scheduling existing staff on weekends and double shifts to meet demand. Hamilton Medical usually produces 15,000 ventilators a year. To put that in perspective, Governor Cuomo said this week that New York State alone will require 30,000 ventilators. CEO Bob Hamilton says he's approached the U.S. Department of Defense to get his automated ventilator technology approved in the U.S. and that they're helping reduce bureaucratic obstacles. Quoting ABC News, "The machines, which are used in nearly every market but the U.S., must receive approval from the Food and Drug Administration or a possible emergency use authorization, which allows for an immediate trial and could mean these automated ventilators could be seen in U.S. hospitals very soon," Hamilton said, end quote. Even as we increase production of ventilators worldwide, however, ABC News chief medical correspondent Jennifer Ashton warns, quote, "When you are talking about ICU care, ventilators don't run themselves. They need respiratory therapists. They need critical care nurses. So manpower is definitely a concern," end quote. Life feels more stressful these days. No kidding. Stores are empty, travel is on pause, work is uncertain. With social distancing now, we need support more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging across any device and hear back daily. 1 month on Talkspace costs about the same as a single in-person therapy session, but with that unlimited messaging access I just mentioned and daily engagement. No need to travel for support or wait for relief. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. We all need to talk through life's challenges, and Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use the promo code BRIEFING for $100 off your first month. My mom said to me just this week that she was sad because she can't send the grandkids care packages for St. Patrick's Day or Easter because she can't go to the post office or the shipping place anymore. I told her, and I swear I am not making this up, there is a solution, Mom. It's Stamps.com. Anything you can do at the post office, you can do via Stamps.com. Their on-demand postage means you can skip that trip to the post office, which, of course, is something we should all be doing right now, skipping any trips outside that we can avoid otherwise. With Stamps.com, you can simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send. Once your mail is ready, just leave it for your mail carrier or drop it in a mailbox. It's that simple. There's no equipment to lease. There are no long-term commitments. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitments. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing at the top for your free 4-week trial. I have to follow up that good news about factory production with some bad news about supply chain. As I said at the top of the show, India is now in lockdown, and with India in lockdown, there are new fears that the U.S. could face shortages of key pharmaceuticals that are produced in India. And I'm not just talking about pharmaceuticals that could help fight COVID. I'm talking about all pharmaceuticals, all medicines for all diseases. Let me explain some background first. The global pharmaceutical supply chain has already been in jeopardy as many key raw materials are manufactured in China before being exported to India, where the final product is made, quoting CNBC. India is the global leader in generic drug production, while China is the world's largest supplier of active pharmaceutical ingredients, or APIs. India imports nearly 70% of its APIs from China and also depends on them for a variety of other key ingredients in drug production. The coronavirus outbreak in China has caused supply issues for Chinese drug ingredient manufacturers, resulting in curtailed production and shipments. However, Morgan Stanley's pharma equity research team noted on Sunday that Chinese manufacturing of API and intermediates, other raw materials, had improved in recent weeks, end quote. Okay, so that's the background. Now, Rohit Bhatt, research analyst at B&K Securities, a Mumbai-based financial advisory firm, estimates that 40 to 50% of U.S. generic drugs are supplied by Indian pharmaceutical companies. Though coronavirus cases in India are still low, just over 500 confirmed cases at the time of this writing, earlier this month, the nation, quote, restricted exports of 13 APIs and the drug formulations made from them in an effort to protect itself against domestic shortages, end quote. As India takes steps to contain its outbreak, including the recent lockdown. U.S. Food and Drug Administration Commissioner Stephen Hahn acknowledges that we may see, quote, potential disruptions to supply or shortages of critical medical products in the U.S., end quote. It's unknown which drugs in particular may be affected since drug companies don't disclose supply chains. And Morgan Stanley's analyst cautioned that shortages could happen more quickly due to customer hoarding. However, the Cohen Pharma team stated in a note published last week, quote, any adverse impact on pharma value chain from COVID-19 thus far has been minimal, and the companies appear adequately positioned for the future, end quote. And trying to end again on some slight good news. According to the Washington Post, scientists who are closely studying the coronavirus's genetic code are reporting that it is not mutating in significant amounts. Its stability is encouraging news for the creation of a long-lasting vaccine, and also suggests that the virus is unlikely to become more dangerous over time as it spreads, though it also probably won't become any less dangerous. Quoting the Washington Post, all viruses evolve over time, accumulating mutations as they replicate imperfectly inside a host's cells in tremendous numbers, and then spread through a population, with some of those mutations persisting through natural selection. The new coronavirus has proofreading machinery, however, and that reduces the error rate and the pace of mutation. It looks pretty much the same everywhere it has appeared, the scientists say, and there is no evidence that some strains are deadlier than others, end quote. Peter Tylen, a molecular geneticist at the Johns Hopkins University Applied Physics Laboratory who has been studying the virus, told the Washington Post that between the original virus that spread in Wuhan and samples studied in the U.S., there are only about 4 to 10 genetic differences. Tylen continued, quote, that's a relatively small number of mutations for having passed through a large number of people. At this point, the mutation rate of the virus would suggest that the vaccine developed for COVID-19 would be a single vaccine rather than a new vaccine every year, like the flu vaccine, end quote. Aside from the potential for a long-lasting vaccine, the small number of mutations also means the different strains of COVID-19 are more similar than some have suggested, quoting the Washington Post. Although one team of scientists earlier this year suggested there might be 2 distinct strains of the virus with different levels of typical disease severity, that conjecture has not been embraced by the scientific community. So far, we don't have any evidence linking a specific virus strain to any disease severity score, Tylen said. Right now, disease severity is much more likely to be driven by other factors, end quote. Other factors meaning shortages of hospital equipment, lack of space in hospitals, and other situational factors. Concluding from the Washington Post, quote, it is possible that a small mutation in the virus could have outsized effects in the clinical outcome of COVID-19, the experts say. That has been known to happen with other viruses, but there's no sign this is happening with the novel coronavirus, end quote. That is all for today's show, produced as always by Ride Home Media. Again, if you'd like to pair this podcast potentially with another podcast to help you take your mind off of things, allow me to recommend the Gaming Ride Home podcast. Video game news every day by 5 p.m. I know my daughter and I have been playing Zelda every night to escape from the world. Be well, everybody. Talk to you tomorrow.